Hey, what's up guys? It's James, the Pioneer PT, and I wanted to talk with you today about self-release, specifically for cyclists and runners. Both involve a lot of repetitive stress. Cyclists, revolutions per minute are about 60 to 80 revolutions. Runners, you hit the ground approximately 80 to 100 times per minute when you're running. And all that repetitive stress can lead to patellofemoral pain or IT band syndrome. Let's go over how to self-release properly. We're going to start with the foam roll. Foam roll is one of the most common methods for self-release. Self-release with a foam roll, you do want to target more on the muscle. You do not want to hit the IT band itself. The IT band itself is about the consistency of a leather belt. It's very hard connective tissue that runs down the side of the knee and attaches to the lateral portion of your knee. Instead, try to focus on your lateral quad and your glutes, specifically the TFL. Many of you have seen foam roll here. You cross your upper leg on top and roll that back and forth. Target at the top of the hip first, specifically again more towards that front half of the hip, so you can hit the TFL, which is the muscular portion that leads into the IT band. You can make a much bigger difference on the muscle than you can the tendon. As you go down, focus more on the front part of your leg, more to the quads on that lateral aspect. Back and forth there. If you find a spot specifically tender, hold pressure to it. Hold it until you feel it release. It may be a minute, 90 seconds, or even a few minutes. And to target that a little bit better, I prefer a lacrosse ball. Lacrosse ball is much more specific and can hit those knots better. So you can start back again in the glutes here, right around the hip. Don't go directly over the bone, but you want to go adjacent to it. Find those knots in the side of the hip. It's often a little bit more to the front. That will be that TFL, which leads into the IT band. When you find that area of tension, hold pressure till it, so you feel it relax. And again, you can also target down by the knee. Try to get more quad. And again, hold until you feel it release. And that's it for self-release today. Please remember, target your lateral quad and the outside of your hip. If you continue to have these symptoms and you cannot maintain a healthy leg, come see your physical therapist. We can target specific strengthening exercises that will prevent that from happening again in the future. Take care. Bye-bye.